This study looks at the prevalence of autistic traits and alexithymia in an outpatient FND program. And just to recap on FND, we know it's a multi-network disorder where neurological symptoms are incompatible with known pathology, and it's associated with network disturbances involved in attention, self-agency, interoception, and emotion and threat processing. Alexithymia is a construct referring to difficulty in identifying and describing emotions. In terms of what we aim to do, as well as report on the prevalence of autistic traits and alexithymia, we also wanted to look at whether they were associated with increased symptoms of depression, anxiety, social phobia, and somatic symptom severity. And one of the reasons for this is that differences in interoception and sensory and emotional processing are common to both FND and autism, as are higher rates of alexithymia. We also felt that undiagnosed autism may add or increase vulnerability to stresses which could precipitate or perpetuate FND. So 91 patients in the outpatient FND program completed self-report measures of autistic traits, alexithymia, generalized anxiety, depression, social phobia, and somatic symptom severity. We found that 40% of the group scored 6 or above on the AQ10, which is the clinical cutoff to warrant further assessment for autism, and 40% scored in the alexithymic range. Then when we divided the group between those scoring 6 or above on the AQ10 versus those scoring below, we found that the group with the higher number of autistic traits reported significantly higher levels of alexithymia, generalized anxiety, depression, and social phobia. When we compared those with or without alexithymia, we found that those with alexithymia reported significantly higher numbers of autistic traits, as well as degrees of anxiety, depression, social phobia, and somatic symptom severity. So we report new evidence of a high prevalence of autistic traits in an outpatient adult FND group, and further evidence of a high prevalence of alexithymia. Both of these were associated with symptoms of anxiety, depression, and social phobia. Clinically, measures of autistic traits and alexithymia could be important in the management of FND, as if the higher number of autistic traits translates into a higher prevalence of autism, then an adapted communication style would be important to consider within the MDT approach, where communication is a key part of CBT occupational and physiotherapy. It would be important to consider carefully how to relay these findings to someone with FND, especially in a therapeutic context, and also especially considering a higher degree of anxiety and depression, as an additional diagnosis could add more stress. Mechanistically, this study offers a limited insight, but alexithymia, which has been reported to be prevalent in 50% of people with autism, has been associated with impaired interoception, which is an important etiological factor to consider in FND. Future research could explore what mediates this relationship through gathering interoceptive data, and it would also be important to look at outcomes of an FND program compared between those with higher or lower number of autistic traits.